Hi everybody. Okay, I'm back. I was inspired to do this video of Songbirddiva for Life video she just uploaded about her testimony as far as being sick and being on all those crazy medications at one time. And my story is not as severe or as traumatic as hers, because that's like a life or death thing. That would just scare the hell out of me if I had to go through something like that. But my situation is like with my two small children, and I'm going to get through this quickly. When I first had my first son, Amir, the week before I gave birth to him, I was having tooth problems. So I went to my physician and said, "Oh, I'm having problems, and I don't know what to take. Is there any other thing I can take other than Tylenol extra strength? Because when you're pregnant, that's the only medication you can take, and that's just to relieve your back pain or a headache or something. You're not supposed to take it all the time. You're supposed to take it in moderation, even just that." So with the doctor, my physician wasn't on call. I think they were out of town or something, so they had the on-call doctor. And she called me back. She said, "Okay, well, I'll write you a prescription for Tylenol 3. And I'm like, "Tylenol 3, can I take that? Are you sure? I'm pregnant." Now, I used to work in a pharmacy at CVS, so I know what Tylenol 3 is. It's a narcotic. And narcotics is the same category as codeine, Oxycontin, Vicodin, all those hardcore painkillers. And they actually keep those in a safe, because they're that expensive and they're that dangerous that they have to be locked up, and only the pharmacist can remove it and issue it. And I was like, "Are you sure?" And she was like, "Yeah, it's okay. That's all I can give you." And I was in so much pain because I had to get a root canal. And I was like, "Okay, fine, give me whatever you can," because it got to the point where it was in my sinuses. My tooth was affecting my sinuses. I had migraine, sinus pain, pressure, and I couldn't even sleep at night. And it was just throbbing. And so I just went ahead and took it to relieve myself of the pain. Okay. So everything's fine. They gave me a 30-pack pill, and they told me to take it every 6 hours. 4 to 6 hours. And I'm like, I'm not going to take no codeine every 4 to 6 hours. I think I may have taken 3 pills before my antibiotic kicked in, which is fine. Antibiotics are fine. And before it kicked in, and then I only took 3 pills, and the rest of the pills I just put in the medicine cabinet. So when I had Amir, I told the physician, as soon as I got to the hospital, "Okay, I've been taking Tylenol 3, which is codeine, for tooth pain reliever, and this doctor prescribed it to me." Okay, fine. They got it. So when Amir was born, he tested positive for opiates, drugs. And I would assume that they thought I was on drugs, like I was a crackhead or something. And I'm like, I don't understand what the problem is, because the pediatrician came in and was like, "Well, he tested positive for opiates, and he's a little jittery." And I'm like, "What do you mean?" And I did notice, like, the next day after he was born, actually, no, the day he was born, he would have these sudden involuntary movements, like, he'd be laying there asleep, and then all of a sudden he'd start shaking, or his little leg would start jittering like that, like he was having a seizure or something, but he wasn't. He was just coming off the drugs. And I was so upset. I was crying. I was like, "Oh my God, what did I do to my baby? I'm a horrible mother. I should have just not taken a Tylenol 3. My gut told me, "Gabrielle, do not take this. This is not right. It's a drug. Why would they give a pregnant woman a narcotic?" And I was in so much pain, you guys. But so we were there, and he had to stay an extra day just to do another urine test to make sure what the opiate was, to see what I don't know. They just wanted to take extra time. I guess they were trying to hold him off just in case, to see if I was on drugs or not, if I tested positive for opiates, or if I had any type of drug history, which I didn't. So day 3 we went home, but they were kind of hesitant to give him to me, because I guess they thought I was on drugs, and I just delivered a drug baby. And technically I did, because I had Tylenol 3 in my system and in my baby's system. It took about a week for the jitters to go away, for him to come down off that medicine, because he had to wean off the drug. And I was totally distraught. I was like, "Oh my God, why if I listened to that stupid doctor?" I was cussing. I was so upset, y'all. Like, that was just upsetting, the most upsetting thing to me. So now on, I don't even take decongestants, especially when you're breastfeeding. But that's another thing. I'm going to do another video called Breastfeeding 101, and I'm going to tell you about everything you eat goes to your breast milk, and your baby gets everything you eat. And but that's another story. So the second time, Isaiah, my second baby, he was about 3 months old. I took him to the doctor. He was having congestion problems, which is normal with newborns. They do get congested. But he had started having this wheezing noise, and I was concerned. So I took it back, took him to the doctor. Doctor said, He didn't even do any type of breathing exercises. He just said, oh, he has asthma. Here's this medicine. Give it to him every 4 hours and on this machine. What? He's 3 months old. I'm not going to hook him up to a machine because you just assume that he has asthma. Like, you didn't even do nothing. You didn't check his heart. You didn't perform any type of breathing exercises. And this is it's a 3-month-old baby. Why am I supposed to give him drugs every 4 hours? Like, what is wrong with you people? Stop trying to give me drugs all the time. Do your job. Investigate. See what's wrong. Like, it bothers me. So, like, Songbirddiva said, do your own research. Like I said, that you said, it's your life. It's my duty as a parent to investigate the different medications that I was taking for my newborn, and then to investigate what type of asthma medicine or why I should give my child that medicine every 4 hours. And I ended up giving it to him the first couple of days, but after that I'm like, I'm not going to give him this for the rest of his life. That box of medicine is still sitting in my cabinet. He hasn't had any problems since. But the man swore up and down he had asthma. And it's like, are you kidding me? He's 20 months year old now. But it's just, God, it just bothered me so much. And that's another thing. Like, I question everything doctors do. With my last baby, Elijah, do you know when they take the blood test for the babies, which is normal to make sure they don't have any problems. But they kept trying to take blood tests from them because somebody ordered the wrong test or somebody wasn't doing their job, essentially. And they kept trying to stick my baby in the foot. And I'm like, why do you keep drawing blood from him? He's only 2 days old. And she was like, well, they did it wrong. I said, okay, well, no, you're not taking his blood anymore. Sorry. You did it twice. I'm not letting you take my baby, keep taking blood from my baby. What is wrong with you? Why y'all didn't get it right the first time? Well, somebody's fault, but he's not going to suffer for it. You have to wait. I'll bring him back when we leave the hospital for that 2-day checkup or 3-day checkup, and then we can do it again. But you know what I mean? You got to use discretion. People, yeah, like you said, doctors make mistakes, nurses make mistakes. Nobody's perfect, but that's just ridiculous. But everybody, do your own research. Be cautious of what you take, and also, in addition, everything you take gives you a side effect, no matter what it is. Tylenol, extra strength will give you a side effect. And what most people don't realize is when you do take a medication, it gives you a side effect, so you take another medication to combat that side effect, and then the side effect and it's like a cycle. Each medication you take creates a side effect, so you're taking more medicine to combat those side effects. And it's like, before you know it, you're on 15 to 20 different medications, and it's not even necessary. You know, so, you guys, just be cautious and leery of taking drugs. Okay. Thank you guys for watching. I'll be back later. Bye.